The asthmatic medications are the ones that I really have to have. So those are the ones that I really stick with. There's one prescription that's like $110 by itself. And I use the Advair Discus, which is like $300 and some by itself. I no longer have Medicaid because of my disability increase. And they felt like I was able to pay for my medication. I reapplied and I was still denied. In April of this year, I was admitted to the emergency room for a chronic asthma attack. Well, actually it was an anxiety attack. And I was there for maybe two to 3 hours and received a bill for like $3,000. But over the course of my illness, I have a total bill of $28,000. My family is not really totally involved. I mean, you know, if I don't have the money, they try to help me get my prescriptions filled. The choice that I would like to make is to be able to get more assistance with the cost of my medication. You know, I know there are not a whole lot of companies that will pay for it totally, except for Medicaid. Since I've been off Medicaid, like I say, some of my the Advair Discus, which is $300 and some just by itself, and which I need to take every day. Even though I know the cost of medication is not based on one's salary, but if there was, say, maybe a certain guideline that people could go by. For instance, if aspirins cost $1, everybody could afford to buy them. They seem to want to just get your money and not provide the service that they portray, that they cover. I've talked to people younger than me, older than me, that have insurance and they're having problems with certain things being covered, outpatient coverage, in-house coverage, prescription coverage, home care coverage. I mean, insurance companies are just not doing what they say they should do. It's all about the dollar nowadays. I mean, everybody's, the economy is just in such an uproar until I think everybody's just trying to get the top dollar for their services. And it's affecting the people that have to pay for these services, more or less.